Now, I want to make certain that you all felt it. Did I cover everybody in class, I hope? Do I expect you to do silly things like I just was doing here? No. This I don't expect you to do in your office. I am merely trying to show you that this is exactly what happened to the mind of the anesthetist. This is what happened to the mind of our own doctor in class. This is exactly what happened to the mind of the gentleman seated in the back who had the amnesia regarding his name and address. Every one of those people locked their mind around a given idea. In each case, the idea must be one which the patient wants. Now, these silly ideas, you only wanted them for the nonce, for just momentarily. And so you wouldn't probably take a suggestion like that in a million years under ordinary circumstances. But since I showed you the purpose that I wanted you to take the suggestion for, you took the suggestions, and only one man failed to lock his mind. But this is exactly what happens in waking hypnosis when you properly apply waking hypnosis. First, the mind of the subject must lock itself around a given idea. Secondly, the suggestion must be one which the patient wants. Any patient suffering intense pain wants relief. He is apt to quickly take suggestions for alleviation of his distress. Any patient facing the prospect of pain, the dental patient is an excellent example, is likewise ready for waking hypnosis. The emotionally disturbed patient is usually ready to listen to the practitioner who shows sympathy and understanding. All these people will take suggestions because they want suggestions. Well, then how do you give them the suggestions? Let the patient hear those words which he is anxious to hear. Now, at this point, I'm going to do something that I think is remarkable. And I do this before doctors, but I assure you I would never attempt to do what I'm going to do now and what you're going to be able to do before laymen. Because if I did this before a group of laymen, I would not succeed. Doing it before doctors, I know that I have to succeed. Every one of you know that that's merely ice water. That is, I hope it's ice water. Certainly is nothing else. And every one of you know that these are swabs. And every one of you know that ice water does not anesthetize, and every one of you know that swabs do not anesthetize. And I'll even tell you that the words I'm going to use are fakes. All the words I'm going to use are phony words. But that's a real instrument, gentlemen, with two, and I'm going to even use words that I shouldn't use, sharp ends. And they're just as sharp as any needles that you have ever seen. And they hurt like the devil. So you see, I'm using a lot of words. Even my semantics are bad. Yet using incorrect semantics, using ice water for my anesthesia agent, using swabs, before doctors who know that the words are fakes, every one of you are going to be anesthetized with what I'm going to do now. Now listen to the words that I use, and I think you will love this because this is your first true application of waking hypnosis and to see why it works. Doctor, you know, the men in the drug houses have really come up with something new and interesting. You know what they do? They put the anesthesia right into the alcohol now, and now when I swab you with this, you become completely anesthetized. And now when I go to work on that area, you will know I'm working there, but nothing will bother, nothing will disturb. Now watch. Doctor, what'd you feel about? Anything that you saw the amount. You see where I pressed. Feel anything in the way of discomfort? Nothing. I would like you to do that to the next man, because you'll find it'll work on the next man just as it worked on you. Most people can't even tolerate that for a second. And if you can get to the place where you can hold it on there and swing it around, and it doesn't bother, and you know that you could leave it there in a minute and it wouldn't bother, you're getting the place where you're getting pretty good anesthesia, I think.
Can you use this as a supplement?
We had a very amusing incident occur for the anesthetist, who was very much a doubting Thomas that he could possibly make it work like this, on this basis that we were just doing it, tried it and got a surprising amount of anesthesia. Is that correct, Doctor? Yes. He had a question that he asked, which I thought was interesting enough, so that I thought that I ought to have him wait and ask the question when everybody was seated. So if everyone will be seated now and we can go back to classwork, we will. Did you fill that with more water?
Yes.
Now, Doctor, will you repeat your question, please?
Now, why, for instance, when you did the previous experiment on Dr. Boyle, it didn't work. Now, why is this working on everybody?
Because every doctor here, whether you realize it or not, the answer involves exactly what I was going to say anyhow. So you're really taking no time with the question. The question really amounts to the answer to what I said a little while ago. I will do this before doctors, but I will never, never do this particular thing that we just did before a group of laymen. In other words, why did it happen to every one of us that we got a remarkable degree of anesthesia with clear water, a little wet swab, and yet the instruments, the Alice clamps and these calipers, are truly devastating instruments, and yet you got anesthesia? Why? Well, has it occurred to you, gentlemen, that since the day you began the active practice of medicine or dentistry, how often you have wished, when you swabbed a patient preparatory to giving them an injection or preparatory to working with something that you knew was going to be uncomfortable for them, how you have wished that you could anesthetize them at the same time. And when I came up with the words, they put the anesthesia right into the alcohol, I was really echoing what you have been thinking below the level of conscious awareness since the day you got into practice. How many times you've thought that? That's why, as these words, particularly welcome to the doctor's ear, he says, oh boy, all I got to do is say that and I get anesthesia. Let's try it. And because he gets the anesthesia, he is amazed, but he forgets that he is receptive to the suggestion, whereas I do this same thing before a group of laymen, and I'll tell you what will happen every time, and I've quit doing it before laymen for that very reason. About the second person you do it to will say, oh, that's a lot of nonsense, it can't possibly work. See, and then after that, everybody begins to feel it. But you'll never hear in a group of doctors that's a lot of nonsense, because the doctor says, oh, brother, how I'd like to make this work. Does that answer your question, doctor? Now, on the other hand, you said, why, when I work with Dr. I don't know, Boyle, did you say, or Boyle? When I work with Dr. Boyle, he's the gentleman who was able to say his name. Is that correct? Well, that was a suggestion he didn't want, whereas here was a suggestion that every doctor wanted, and I assure you that if Dr. Boyle, I don't know whether he tried this or anybody tried it on him or not. Did anybody try it on you, doctor? Well, somebody should have tried it on you, and you'd see he would not be averse to this suggestion. And I'll prove it to you. Doctor, would you come up here, please? Now, see the difference when a person wants something to happen and when a person doesn't want something to happen. You know, they've come up with something rather astounding here lately. They've put the anesthesia right into the alcohol. Now when I swab you with this, won't you sit down, Doctor? Just sit down and draw your chair up. Now when I swab you with this, nothing will bother, nothing will disturb. You'll just lose all feeling in that area. Now watch. I'm going to stroke right here, and nothing will bother, nothing will disturb. You'll know I'm working there, but nothing will bother. How'd you feel, Doctor?
Nothing.
See what I mean? That's how simple it is. Because why? It's the very simple thing. He wanted this suggestion. Gee, he's just as much a doctor, I guess, as anybody in the group. And he says to himself, wouldn't that be nice if I could actually make that happen? And he made it happen. Isn't that just about a translation of the thoughts, Doctor? Sure. One suggestion he wanted, the other suggestion he didn't want. Now, on the other hand, when I had the other doctor take the suggestion, did somebody try this on you, Doctor? Did somebody try this on you? You did. Now, when I tried it on him, I sold him the idea because I said, want this to happen. And watch it happen. And so it was intriguing to him that it'd be a nice idea to want it to happen. And so he wanted it to happen, and because he wanted it to happen, it happened. It was as simple as that. While many of our doctors have used waking hypnosis beautifully, perhaps one of the greatest exponents of its use is Dr. Flaherty of St. Francis Hospital, where we made the motion picture in Milwaukee, Wisconsin. Dr. Flaherty said to me a few weeks after he'd had this particular session, he says, Dave, I wonder how many of your men can say that they have actually done deep abdominal surgery with waking hypnosis. I said, well, I haven't had many reports like that, I'll tell you that. And he says, well, I'll tell you, I used the exact technique that you taught us, and I got such perfect anesthesia that I was able to go ahead and do surgery on a cardiac case where I couldn't have used much anesthesia anyhow, but in this way I avoided the use of any anesthesia. Now here was the technique used on the deep abdominal surgical case, which Dr. Flaherty did. Subsequently, he did it again and again and again and again to prove to himself and to me that he could do it, and do it successfully with waking hypnosis. He said to the patient, have you ever been anesthetized before? And when the patient said yes, he said, well, I'm glad to hear it, because we have a capsule here which follows the exact nerve pattern of the previous anesthesia. All I have to do is have you swallow this, and you'll be completely anesthetized in every area where you were anesthetized before. And in about 30 seconds, you'll have complete anesthesia wherever you had it before. And he says he had him swallow the capsule. 30 seconds later, was able to take towel clips and attach them any part of his body without the man feeling them. Went ahead and did the surgery, for he said, when I could see that he didn't feel the towel clips, I knew that he wouldn't feel the incision any more than the towel clips, so I just went ahead and did the incision. And he said, remember that I had tested with the towel clips in tender portions of his anatomy, so that if he would have felt it, I wouldn't have gone ahead with the surgery. But since he didn't feel the towel clips, I went ahead and did the surgery. Do I ask you to do it? No, I'm not asking you to do it. But I am saying that it is possible, and that several of our students, we've had about 10 to 15 reports like that over the years. Do I just want you to learn how to give an injection by what we did tonight? Oh, no. How do you put waking hypnosis to use in actual medical or dental practice? Well, you know how you do it in dentistry. Here, let me show it to you. And I don't think anybody can say that this isn't a pretty effective way of getting anesthesia. Somebody who dreads dental work, come on up, won't you, please? Doctor, you're in dentistry. Well, look, I had you do something else before, didn't I? Would you come up, doctor, please? I didn't have you do anything tonight, did I? All right. Now, doctor, swab the inside of her mouth. Give her the same story about they put anesthesia in, the very same thing that you did before, and you'll get perfect anesthesia in her mouth.
We have a new anesthetic here that is put in alcohol, and you'll feel nothing at all. This will bother you or upset you. You will just feel pressure.
Now watch this, and you'll have perfect anesthesia. Satisfied, doctor? Now, can you use waking hypnosis in dentistry? Of course you can. And madam, may I ask, did you feel anything at all?
Just pressure.
Just pressure. You can drill and everything else with that. And you'll have just as good anesthesia as you ever had in your lifetime with chemical anesthesia. It'll give you as good an anesthesia as Xylocaine will give you any time. Now, remember, you must lock the mind of the patient around the idea. Don't think that you can say, well, now you're going to be completely anesthetized and go up and do the work, because the patient's mind isn't locked around the idea. The patient must have happened to him exactly what happened to you when you had your fist closed or when you had your legs up and you couldn't move the legs, when your mind was locked around a given idea. That's what you must do to your patient to get the waking hypnosis. You ask an old student, he has never succeeded with waking hypnosis where he hasn't locked the mind of the patient around the ideas. You must lock the mind of the patient around a given idea, and the idea must be one to which the patient is receptive. I mean by that every patient wants anesthesia, so they're receptive particularly to anesthesia. How would you use it in various branches of medicine? In dentistry, doing just what you did now, you saw what a perfect anesthesia you get. So you continue to use it, and you only use it in those cases where you haven't got time to go after the trance state, where even that time is valuable to you, and you say to yourself, I'm going ahead without waiting. I want to get to work right away on this patient. I'm late. And that patient will have perfect anesthesia if you lock the mind around the idea that she has perfect anesthesia. You make your test beforehand to make certain, but you'll find that you get as perfect anesthesia as anything xylocaine will produce. It'll last for the entire dental treatment and last for the next 10 dental treatments, or 20 or 30 or 40, providing the mind of the patient is locked around a given idea. And that idea is anesthesia. For instance, your mind was locked around anesthesia, so it would have lasted just as long as anything painful had to be done to you. Now, how would you use it in other branches of medicine? Take, for instance, the man in radiology in Providence, Rhode Island, who came to me after this class was over, and he says, you know, Mr. Ellman, I love everything you teach, and I put it to work so beautifully, but he says, tonight you've taught something oh, sure, it's interesting for a toy to know about, but I don't see how I can use it in radiology. And I said to him, Doctor, you don't see how you can use waking hypnosis in radiology? What is the biggest problem you have in radiology, doctor? And he said, giving barium enemas. It's been a problem since the day I got my boards. Long before I got my boards. I've never been able to give a barium enema and not be sure that there isn't going to be an accident or something of the sort. It's been terrible. I said, all right, doctor, how do you approach the patient on whom you have to give a barium enema? Well, he says, since all my work is referral work, I'll generally start by saying, well, you're Dr. So-and-so's patient, and he tells me that you've been having trouble with your stomach for the past month or two, and he wanted me to get some pictures to find out what's causing the trouble. Now, in order to do that, I have to do a procedure which isn't very comfortable, but I'll do my best to make it as easy on you as I can. And then I start the barium enema. And I said, no wonder you have accidents, doctor. You are giving that person unnecessary pain and discomfort and everything else. He says, what do you mean I'm giving it? I said, well, you're lying to that patient, and you're lying in the wrong way. Now, if you have to lie to the patient, why don't you lie to the patient in the right way? He said, I'm not lying to the patient. I said, oh, yes, you are, doctor. You are certainly lying to the patient when you tell him that, because a barium enema doesn't have to be uncomfortable at all. Would you like to know how I would give a barium enema? And I have never given a barium enema in my lifetime. He says, yes, I would like to know. How would you go about it? I said, well, you tell me that these patients have generally been in discomfort. He says, yes. I said, well, your approach would add to their discomfort. My approach would minimize their discomfort. He said, well, tell me how you would do it. I said, well, I would say to the patient, you're Dr. So-and-so's patient? Yes. And he tells me that you've been having trouble with your stomach for the past month or two, and that you're probably having distress with it right this very minute. Is that true? Oh, yes, these aches and pains last all the time. Well, you know, maybe it's a fortunate thing that you're here this afternoon. Fortunate that I'm here this afternoon. I'm a sick man. What do you mean I'm fortunate? Well, if you've been having distress, you're fortunate, because I think we can alleviate that distress a great deal this afternoon. You see, the doctor wants me to get some pictures to find out what's causing that trouble in your stomach. And in order to get those pictures, I have to coat the lining of your stomach with the most soothing medication that has ever been devised. The minute that this medication hits the lining of your stomach, you'll feel better than you've felt for weeks. And I said, now, doctor, start your barium enema. I'd never do that. I'd never do that in a million years. I'd feel I was a fake and a charlatan and a quack and a fraud, and I just wouldn't do it. All right, doctor, you lie to the patient your way and give him more pain, and I'll lie to the patient my way and give him less pain, and let's see in the long run who winds up the best. And he said, but I would be lying. No, you're not. You're lying anyhow, doctor. Don't tell me you're not lying to him when you make that approach. Anyhow, this is what happened that night. When we did a demonstration in Providence, Rhode Island, a year later, or thereabouts, there were about 300 or 400 doctors came to the demonstration, and this student of mine asked if he could talk to the doctors. And since I was very proud of him as a student, I said sure. And so he told the story exactly as I have told it up to this instant. And then he added, so I left Mr. Ellman's classroom that night determined that I was never going to use waking hypnosis in radiology. But Mr. Ellman had said that I increased the discomfort of the patient, and a few days later, a patient came into my office who was in sore discomfort already. He was in agony already, and Mr. Ellman had said that my approach adds to his agony, and I didn't want to add to his agony. So inadvertently, without meaning to, I found myself stumbling into Mr. Ellman's exact words. I said to him, well, thank goodness that you're here today, because we can certainly make you a great deal more comfortable than you have been. After all, to do what the doctor wants me to do, get these pictures, I have to coat the lining of your stomach with a most wonderful, relaxing agent. It'll just relax your stomach and make you feel so good. And he said, then I went ahead and I did the barium enema on the man. I was the most amazed person, for no sooner had the barium enema started than he began to rub his stomach and saying, oh, doctor, that's wonderful. Oh, doctor, that's wonderful. Why didn't my other doctors know this? Oh, that's wonderful. And he says, since that day, I have given 1,212 barium enemas without a single miss, in the entire time that I have been doing them. Now, he says, when you figure to yourself that in the old days I used to have accidents, people used to have cramps, I didn't know how to alleviate their cramps or anything, I'll tell you how well it worked. I had to come back to Mr. Ellman 2 weeks later and say to him, Mr. Ellman, that waking hypnosis works so beautifully on my patients for barium enemas that they retain the enema and won't let it loose. How do I get them to get rid of the barium? I'll never forget that. So I said to him, well, doctor, it's all suggestion. Just tell him it'll come out as easy as it went in, and that's all you have to do, and it will. And it did, and that solved his problem, and from then on he didn't have the problem. I must tell you that Dr. Kitchen in Kansas City is a radiologist. And during the time that I was telling this little incident, he says, well, I've got something more wonderful to tell you than that, even, Mr. Ellman. He says, on this waking hypnosis thing, he says, I wonder if you realize that that's the reason I'm in your course. Incidentally, he is the president of the medical society in that area. So I said, what is the story, doctor? He says, well, it didn't happen to me because I wasn't a student of yours at that time, but it happened with one of your last year students, a radiologist who was in your last year's class. It seems that there was an obstetrician an OB-GYN man, who had a patient on whom he had to make a pelvic examination, and any time he went to make that pelvic examination, that patient put up such a fuss that he couldn't get to first base in making the examination, but he needed the examination for such an important reason. In fact, he wanted pictures taken. So he sent the patient down to see your student, who was an X-ray. So she gets down there, and for some reason or other, it is necessary for the radiologist to make an examination too. So he uses your waking hypnosis, and he makes the examination without a bit of discomfort at all. Now the girl has to go back upstairs to see the OB-GYN man. And so the OB-GYN man, in talking to the radiologist, said, you know, I've never been able to do an examination on this patient at all. And the radiologist said, well, I just made an examination without any difficulty at all. So she's going right back upstairs to the OB-GYN man, and he wants to get a reading, same as the radiologist got the reading. So now he goes to make an examination. Remember, this is only about 2 minutes after she's had a previous examination without feeling a thing. And now she jumps off the table and she says, "My God, why is it that you hurt me when you make an examination? And the other doctor, I couldn't feel a thing while he was making the examination." So he calls up the radiologist and says, "What did you do that made it possible for you to get an absolutely pain-free examination, and I make an examination? I'm supposed to know how to make an examination on a woman." And she jumped off the table and complained of the pain. Now, he says, "I heard the story from the radiologist, and that's how I happen to be a member of your class this year. So, how was the examination done?" Well, in order to do that, you've got to go back a few years to the time when we had in our class in Washington, D.C., a professor at Washington University, George Washington University, I should say. He is an OB-GYN, and one of his students, who is now in active practice and a very successful OB-GYN man, comes to him and says, "Doctor, don't you occasionally run across a woman, a young girl, for example, on whom you have to make an internal examination, and she puts up such a holler, she puts up such a fuss, she is so tense that you can't even approach her?" "Why, of course, every OB-GYN man has encountered that." He says, "Well, what do you do? What can you do in a case like that? I've got a patient now. I can't get near to make an examination, and I must make an examination. What do I do?" He says, "Well, I'll tell you. The next time she comes in your office, you tell her she's very fortunate that she's there today because you've just received from Vienna the most wonderful relaxing agent that medicine has ever discovered. All you have to do is to swab her with a little bit of it, and despite all tensions that she might want to hold on to, that will automatically relax every muscle inside of her, and you'll be able to do the examination without a bit of discomfort to her. Get a little bit of vaginal jelly, take it out of the tube, and make sure that she doesn't know what it is. Have it on a piece of paper. Now go out there and say, 'Now I'll swab you with this,' and you just won't feel a thing. Now swab her with it externally and say, 'I'll just wait a minute or so for the relaxing agent to take effect.' And he says, then after about a minute, say, 'Well, now the relaxing agent has taken effect, and you'll be so relaxed you just won't feel a thing.' Go ahead and make your examination, and she won't feel a thing." This was so successful when the doctor tried it that our following class in Washington, D.C. was composed entirely of OB-GYN men. And the men have been using that technique ever since. And this was the technique which the radiologist knew. I want you to know that you can use it, and be sure that you will get results with it if you lock the mind of the patient around a given idea. Now, don't tell the patient, "Now, you must think like I direct," and all that nonsense. You don't do anything of the sort. You do it as casually as we did it. "I'm just going to swab you with this relaxing agent, and in a few seconds, you can hold on to those tensions if you want to, but this medicine won't allow your muscles inside to hold on to them, and you'll just relax every muscle, and you won't feel a thing while I make the examination, and you'll find it'll work for you beautifully." Suppose you have to anesthetize the rectal area. I am very delighted to say that well, it's right in this town, isn't it? You heard one of the men say that in my lifetime I had never believed that it was possible for there to be such a thing as a painless proctologist. Wasn't it here that this statement was made? And he says, "But I want to tell you that since I learned waking hypnosis, I am a painless proctologist." The rectal area is one of the most difficult areas of the human body to anesthetize, as every doctor knows. All right, just swab them with almost anything that you've got. Tell them in a few seconds that area will be completely anesthetized. You won't feel a thing. Now go ahead and make any examination that you want to make, and they won't feel a thing. Suppose it's right after the hemorrhoidectomy, and it's time for the first bowel movement, and you know that usually the first bowel movement is looked forward to with great trepidation by the patient. You merely come to the hospital and you say to them, "Now I'm going to make absolutely sure that you don't feel this bowel movement when it occurs, and so that you're absolutely comfortable during the entire procedure. It'll be just like any other normal bowel movement. You won't have any difficulty at all. I'm going to swab you with this anesthesia. This anesthesia will be so intense that when you have your first bowel movement, you won't even feel a thing. And gentlemen, they won't feel a thing. That's why this doctor was able to say, I am a painless proctologist. Suppose you have to anesthetize the canal for a cystoscopy, male or female. Touch the tip of the canal with a lubricant. Tell the patient, now I'm going to anesthetize this entire area, and you just won't feel a thing. Now, put lubricant on your instruments, whatever you have to use for the cystoscopy, and say, and I'm putting the anesthesia all over this instrument so that you don't feel a thing. And you won't even feel any discomfort before, during, or after. And you can even eliminate that burning sensation that usually occurs to the patient afterwards. At this point in our classes, I generally take time out for any doctor's specific problems. Remember, I am not a doctor. All I can do is to tell you how I, with my knowledge of hypnosis, would face a particular situation in your practice.